Maybe you're a nursing student and you are still trying to figure out which direction you want to go when you graduate nursing school. Or maybe you are a bedside nurse getting the soul sucked out of you at your current job and you are wondering about aesthetics and if it's a good direction for you to go in. If either of those is you, then hopefully I can answer a ton of questions for you today in this video. I am going to go over the main differences between bedside and aesthetic nursing, including income, schedule, benefits, the client interactions, creativity, autonomy, etc. And if there happens to be anything that I miss in the video, please leave me a comment and I will respond to you either directly with a comment or with a video. So first of all, who am I and why am I making this video? I am Nadia. I am an aesthetic nurse injector. I'm based in California. Before I got into aesthetics, I was a bedside nurse for 7 years. I have been in the aesthetic field now for almost a year. In a week, it'll be a year, which is super exciting. So I have experienced both worlds and feel that I can give you a pretty good comprehensive answer to most of your questions. Now, I am based in California and I know the laws are different all over the country. In some states, nurses cannot even inject at all. You have to be like at least a nurse practitioner to practice in aesthetics. Also, I understand that income rates are so variable across the country. They are usually the highest in California. They are at least for bedside nurses. So I can only speak to that as well. But overall, everything should apply no matter where you're watching from. Okay, so one of the main differences will be your schedule. When you are working at the bedside, whether you are in a hospital, in a clinic, really those are the main places that a bedside nurse would work. But the most common schedules would be 3 12-hour shifts a week, 5 8-hour shifts a week, 4 10-hour shifts a week, or if you are in a clinic, that would be more like 5/8, so Monday through Friday, 9 to 5 sort of a situation. 3 12-hour shifts is amazing. To get 4 days off is so nice. Granted, you are extremely exhausted from work because 12-hour shifts really drain you, especially if you're a night shift and your shifts maybe aren't consecutive and the day before your shift and after your shift are kind of ruined. Still, it's definitely nice to have 4 days off in a week. In aesthetics, my personal schedule is kind of up to me to make, which is really nice. I can make myself available whenever I want, really, and then clients can book with me. And that is my situation right now. That's not going to be the same everywhere. Clinics, med spas, dermatology offices, they will all have different situations. If it's a dermatology office, it will be more of a Monday through Friday situation, usually only open and business hours, kind of like when a doctor's office would be open. That is a type of schedule that you might have. If you are in a med spa or maybe practicing on your own, you may be able to make your own schedule. I only work 4 shifts a week. My shifts are never more than 6 hours, so that's amazing. I'm working way less than I did before. If you are working somewhere like a derm clinic or a plastic surgery office, maybe that they're closed on the weekend, so you'll never have to work a weekend, which is great. Maybe you are practicing by yourself or you have more liberty in your schedule making and you want to work weekends because you may be busier on those days, make more money those days, yada yada. It's much more flexible, I feel, in like your options of when you can and want to work. For myself, I have much more flexibility in when I can work. I do give myself a pretty consistent schedule. I think that's nice for clients and it's easier for me to be able to plan, but it's nice to be able to put my own schedule in instead of knowing my life only 1 month ahead at a time and having to ask permission for vacation and blah, 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 all of that. Like the politics of hospital work are very different when it comes to your schedule. Maybe you don't have seniority and you don't get holidays off and yada, yada. So in the aesthetics business, you're not gonna be working on a holiday. no office is going to be open on Christmas or Thanksgiving. These are all elective procedures. There are emergencies, but you don't have to be open all of the time, which means you don't have to work all the time. Okay, the next big difference that I want to talk about is your patient base. I remember the first time that I shadowed an aesthetic nurse, I was in shock. We say client now. Now that we're in the elective procedure field, they are clients, not patients. So every client that this practitioner saw was so happy and excited to be there. They are usually really nice, normal people who aren't sick and disease-ridden, sad and depressed and schizophrenic. You get the idea. If you are already a nurse, you know exactly what I'm talking about. So these are people that are walking in to your place of work, handing you money, and are ecstatic to be stabbed in the face with needles. Okay, so just like try and imagine that. And then you go into the hospital. Everyone that you meet, all of your patients, it's like one of the worst times in their life. Either they're sick, their family is sick, they don't want to be there. No one likes the hospital. They're feeling their worst. Like, God bless nurses for getting people through their tough times and situations. But when that's your career, you are dealing with that constantly. Sometimes being around that environment, that kind of energy, like really weighs on you and affects you in your mind. Patients are violent. They're crazy. They can hurt you. Like, someone literally has spit in my face. It's crazy, the things that you see and have to deal with. And people just feel like it's normal for nurses to be abused. It's so wild. It blows my mind. But that is a giant difference, that the people you are dealing with on a daily basis are either healthy, wonderful people that you get to help feel better about themselves and their skin and help them gain more confidence, or you have sickness and sadness and depression and just negative energy. Obviously, not all patients are awful. Like, I've had plenty of wonderful human beings that I got to take care of. This also probably depends a lot on where you work. I was at a level 1 trauma center in the capital of California. So it was bananas, the people that we would see, not a ton of normal ones. It was weird when you got a normal patient. That was a rarity. So that's a huge difference. Like, in aesthetics, everything is elective. If I don't like someone, like the vibe I get from them, or if we don't really mesh, if we're not like seeing eye to eye, I don't have to treat them. Imagine being able to refuse a patient just because you're like not on the same page. It's not like that at the hospital at all. So that is something to think about, just the people that you're dealing with constantly on a daily basis at work. Another big difference for me, this may not be important to you, between aesthetics and bedside is the level of creativity and autonomy that you get to practice. If you're a creative person like me, then the bedside will suck you dry. It is soul sucking. Literally, the most creative thing you do in the hospital is cleverly manage your time. I would be stoked to get all my 9 o'clock med pass done by 8:45. Like, that was my big win for the day. That's it. But in aesthetics, your job is literally to be creative. It's so nice. And like, the autonomy that you get in aesthetics, once you are, done with your training and you're safe and you know what the heck you're doing, you are treating your patient. This is your patient. You decide what you're doing. You make a treatment plan with them. You can have your own style of injection. My specialty is lips. Like, I have a way that I do lips. People come to me specifically for that. And it's not like I'm asking permission of anybody to, can I do this next? Can I get an order for this? It's not like that. It's me, my eye, my brain, my hands, and my client, which is really nice. Whereas in the hospital, you are, especially if you work at a Kaiser, oh my gosh, your hands are so tight and just everything is, please doctor, can I do this? Like, obnoxious. Like, how horrible is that? What did you go to school for? I remember one time in the hospital, I asked a surgeon why he had prescribed a specific med for my patient, because I'd never seen it before. And his response was, it is not a nurse's place to question a doctor. So there you go. The next difference I'm going to talk about is education. If you are not into learning constantly, aesthetics is not for you. In my bedside job, obviously you go to school to become a nurse, and then every 2 years you have to renew your license. So I would go on some website where they would give me really cheap courses for CE credits, and I would take a test. I don't know, it'd take me like 15 minutes, and that was my continuing education for the next 2 years. Maybe you have some modules you have to complete every year to be compliant, like in your hospital system. That's it. Unless you are going back to get your NP or something, or if you're in a specialty and you need to learn ECMO, you're in ICU, whatever, there is no requirement to be continually educated. In aesthetics, a field that is elective and makes a ton of money, there's a ton of technology, science, and money that is progressing the field constantly. Something is new all of the time. Injection techniques change all of the time. There's new machines, there's new fillers, there's new trends. It's constant. You need to constantly be educating yourself. You can fall out of touch really quick, and your clients will know. This is the kind of stuff people are on TikTok just like researching. They know everything about lip filler. They know everything about Botox. They know everything about the new laser machine and the peels that you do and all of this. So you can't be less educated than your client base. They will find out real quick and they will drop you like a sack of potatoes. You need to be like at the cutting edge of all aesthetic innovation to really serve your client base well, because they deserve the best of the best. They deserve to have a practitioner that knows what's possible, what's out there, what the best thing is for them. So I've not even been in aesthetics an entire year. I'm literally filming this at a hotel because I am at a conference in Beverly Hills. I actually have, I think I have a list of trainings that I've already attended, and I'm not a year through. So I've had at least 2 injection trainings with Galderma. I've had in-office trainings covering Sculptra. I've had to travel to Napa to get a specific sculpture training. I've had 2 in-office trainings on Radiesse, 2 in-office trainings on RHA, which is a brand of filler. I had to go to Texas to get trained on a specific laser. I went to Illinois to learn ultrasound and how ultrasound can be added into an aesthetic practice for safety purposes. I've had to go to LA to get trained on threads. I actually got trained by Tom Van Eyck. He's a big deal from Amsterdam, but our office had him come out to train us on like a technique he invented. It's called the Fern. That means nothing to you, but it's a lot. That's a lot of training, and if you're super lucky, you're at a place that will fund a lot of that for you, but you do also have to be willing to come out of pocket for that education. I also belong to multiple injectors Patreons that like share information constantly, so literally every single day you need to learn something, and if that is not what you're about, then aesthetics is not for you. The last category I want to discuss with you is social media. So as a bedside nurse, this may be changing a little bit because there are like TikTok famous nurses now, and there's like Nurse Blake and stuff like that. So it's not a no-no to have social media as a nurse. It's not. But when you're like applying for a nursing job, like an acute care job, it's almost like you want to hide your social media. There's not that freedom to be yourself on the internet or show what you're doing. Like obviously you can't film in the hospital or be filming your patients or procedures or stuff like that. It's very like removed. Like your social media is a private thing, nursing is a separate thing. In aesthetics, you literally need to bang it out on social media to be successful. The only reason that I'm already like having weeks that are fully booked as such a new injector is because of social media. Nobody would know who I am or if I was any good at what I did. It's definitely made to look like a very glamorous side of nursing, aesthetics on like Instagram and stuff, but that's what like your clients want to see. So you have to put that stuff out there. That's how people find you. That's how you'll make more money. That's how you'll grow. So that's huge. If you get hired at a place and you're commissioned right off the bat, you better get your face out there on social media for people to find you, or you'll make no money. So that's a huge difference. But that also means that you're working constantly. I work all the time. I think about work all the time. There's always something I could post. There's always something I can document or teach about. But I love that. I was doing that kind of stuff anyway. So it's not a con to me. It's a pro for sure, but also something you should think about. Just really think about what you are willing to do and like the effort you're willing to put in to go into this type of career, because it does take a lot of effort. You can't just show up, do your job and leave. It's not an industry like that, but it's so worth it. I promise you. If you are the right person, it is so worth it. It's so fun. I love it. I'm obsessed with my job. So if you guys have any questions on anything I talked about, if I missed something, please leave me a comment down below. I love helping with stuff like this. I could talk about aesthetics forever. So if there's any way I can help you, let me know. I do have a resume guide that I made if you are looking to get into aesthetics. It's like a laid out template that walks you through each section of how your resume should be if you're trying to get into aesthetics. So I'll link that down below. And yeah, thank you so much for watching. I have a handful of other aesthetic nursing videos on my channel, so I will just link the playlist in the description box, and hopefully I'll talk to you guys soon. Bye.